Assalamualaikum and hi everyone. My name is Muhammad Arif Ibrahim, metric number 060003. And today, we are from Group 5 Dietetics are going to discuss with you about the pathophysiology of cerebral palsy. As you can see from the slides, here are the list of presenters and the contents of the slide. The first one we have the definition and etiology of cerebral palsy, which will be presented by me myself. Next, we have pathological disorder, which will be presented by MOHAMAD WAFIQ. EFFAH RAIHANAH will discuss with you the clinical signs of cerebral palsy. For nutritional management, it will be presented by AHMAD HIFZHAN, and last but not least, FARHANAH NABILAH will conclude everything from today's discussion. I hope everyone can stay focused and learn a lot of new things from today's presentation. Now, we are going to talk about the definition of cerebral palsy. Cerebral palsy is a long-term motor disorder caused by a non-progressive, also known as static brain injury. Cerebral palsy is the clinical manifestation of a variety of neurological, cortical, or subcortical insults that happen during the first year of life. Cerebral palsy affects children in a variety of ways, including mental retardation, epilepsy, feeding difficulties, and visual and auditory impairments. People with cerebral palsy may have swallowing difficulties and eye muscle imbalance, which occurs when the eyes do not focus on the same object at the same time. They may also have restricted range of motion at various joints of their bodies as a result of muscle stiffness. Here are some etiology of cerebral palsy. The causes of cerebral palsy are multifactorial. The first etiology is premature birth. Premature birth contributed in a condition known as periventricular leukomalacia, abbreviated as PVL. This is a condition in which the blood supply to the baby's underdeveloped brain is insufficient. As a result, some of the tissues surrounding the ventricle begin to die. The insult caused by this condition resulted in upper motor neuron lesion, which leads to cerebral palsy. Hypoxic ischemic insult is the second etiology. Hypoxia refers to a lack of oxygen, whereas ischemia refers to a lack of blood flow. The basic function of the placenta, as shown in the second image here, is to provide oxygen and nutrients to the growing baby. A placental issue, such as placental insufficiency, disrupts oxygen delivery to the baby brain. This is one of the potential causes of cerebral palsy. Kernicterus is the third cause of cerebral palsy. Kernicterus occurs when there is high level of unconjugated bilirubin. Unconjugated bilirubin piles up as a result of excessive hemolysis of red blood cells. The liver is thought to be in charge of eliminating unconjugated bilirubin. However, because the baby's liver is still developing, it may not be efficient enough to eliminate all of the unconjugated bilirubin. As a consequence, unconjugated bilirubin will cross the blood-vein barrier and cause damage to a variety of brain tissue structures.
There are a few classifications of cerebral palsy. The first one is spastic cerebral palsy, which is the most common, accounting for 77% of all cases. Most people with this type of cerebral palsy have high muscle tone and exaggerated, jerky movements, also known as spasticity. Spastic cerebral palsy is caused by damage to the motor cortex and pyramidal tract of the brain. Damage to the brain's motor cortex will disrupt its ability to control voluntary movement, whereas damage to the pyramidal tracts will result in problems and issues in relaying signals to body muscle. In addition, the ability of the neurons to receive GABA, a type of inhibitory neurotransmitter, is impaired. GABA is responsible to block specific signals in order to provide the brain with calming and protective effect. Therefore, if the nerve impulses cannot be inhibited, the nerve will be overexcited. There are three subtypes of spastic cerebral palsy. The first one is spastic diplegia. According to Maret and others, 2013, spastic diplegia is the most common motor subtype in preterm infants and it is significantly associated with diffuse white matter injury with intraparenchymal hemorrhage or periventricular cavitary lesion. The muscle stiffness is most common in the lower extremities of the body, which are from hips to toe. This type of cerebral palsy may also have a minor impact on the child's arm mobility. The second subtype is spastic hemiplegia. Here, the movement issues typically affect one side of the body, with the arm being stiffer than the leg. The last subtype is spastic quadriplegia. From this type, all four limbs as well as the torso and face are affected. Co-occurring disorders such as epilepsy are common in children with quadriplegia. The second classification is dyskinetic cerebral palsy. Dyskinetic cerebral palsy, also known as non-spastic cerebral palsy, affects about 2.6% of children with the condition. This type of cerebral palsy is caused by damage to the brain's basal ganglia. The basal ganglia is important in the regulation of voluntary motor function and eye movement. This type of cerebral palsy will result in involuntary movement of the face, torso, and limbs. Dyskinetic cerebral palsy is also described by a fluctuation in muscle tone caused by a combination of hypotonia, which means loosened muscles, and hypertonia, which means stiffened muscles. The last one is ataxic cerebral palsy. Ataxic cerebral palsy accounts for approximately 2.4% of all cerebral palsy cases. Ataxic cerebral palsy is caused by damage to the cerebellum, which is in charge of coordinating physical movement. This type of cerebral palsy causes ataxia as well as problems with balance, coordination, and voluntary movement. Ataxia means lack of muscle control or coordination of voluntary movements, such as walking or picking up objects. Finally, tremors and a reduction in muscle tone are major signs of ataxic cerebral palsy.
Hello everyone, my name is EFFAH. So today I am going to discuss about the clinical signs of cerebral palsy. So the signs and symptoms of cerebral palsy can be detected since the early stage of life, and it can be categorized as problem in three main categories, which are problem in movement and coordination, problem in speech and eating, and the last one is problem in the development. So let's go deeper on the signs and symptoms. The first one, the problem in movement and coordination. The symptoms of this problem include stiff muscles and exaggerated reflexes, which is the most common problem, and stiff muscle with normal reflexes, tremors, favoring one side of the body, such as dragging a leg while crawling, difficulty in walking, such as walking on toes, as you can see in the above picture, and the difficulty with fine motor skills, such as buttoning up clothes and picking up utensil, and also lack of balance and muscle coordination, which is ataxia. Secondly, the problem in speech and eating. The problem in this category can be seen in delay in speech development, difficulty speaking, difficulty with sucking, chewing, or eating, and lastly is an extensive drooling or the problem with the swallowing. Next, we got problem in the development, where it includes problems such as delay in reaching motor skill milestones, such as sitting up or crawling, learning difficulty, intellectual disability, and delay in growth, which result in a smaller size than the expected size for the specific age. Other than that, because cerebral palsy bring damage to the brain, it can lead to a few neurological problems. For example, seizure, which is epilepsy, the difficulty hearing, problem with vision, and abnormal eye movement, abnormal touch or pain sensation, bladder and bowel problem, which include constipation and urinary incontinence, and the last one is a mental health condition, such as emotional disorder and behavioral problem. So that's all from me. I hope you are clear for the clinical sign of cerebral palsy. I will pass the next slide to my friend.
Thank you, EFFAH. Now let's move on to the nutritional management of cerebral palsy. Rehab 2021 states that we need to consider their condition before determining their nutrition intake, such as their motor impairments, their digestive system problems, and their chronic constipation, but generally, patients with this disease need to consume high protein intake because protein plays important roles in promoting muscle development and tissue growth. Calcium helps in secreting hormones and control blood flow constriction and relaxation. It is also necessary for muscle contraction. Phosphorus. Phosphorus is a mineral that plays a role in the growth of bones and teeth. Next, vitamin D. Vitamin D can help in the absorption of calcium and it can be found in fish, fish liver oil, vitamin D supplemented milk, and cereals. Lastly, if one of the macronutrient and micronutrient is inadequate for their body, the patient needs to get advice from the doctor, and usually this patient need to consume supplement. There are many foods to avoid for patients with cerebral palsy, but the famous ones are processed meat and junk foods, excessive red meat, and lastly, ice cream and cheese.
Let me now summarize what my group mates talk about. Cerebral palsy is a group of disorders that affect movement, coordination, and muscle posture. Cerebral palsy are caused by abnormal brain development or injury to the developing brain. It affects the cerebral motor cortex, which is the part of the brain that directs muscle movement. The most common etiology of cerebral palsy are due to premature birth, infectious, traumatic, and genetics. Signs and symptoms of cerebral palsy can be different in each child. Cerebral palsy can affect the whole body or it might be limited primarily to one side of the body. Generally, signs and symptoms include problems with movement, coordination, speech, eating, and the development. Lastly, cerebral palsy can't be prevented if it's caused by the genetics problems, but it may be possible to manage or avoid some of the risk factors for cerebral palsy. For example, making sure pregnant women have been vaccinated could prevent certain infections that can cause cerebral palsy in the unborn babies. Or attending regular appointment with your doctor during pregnancy that can help premature birth or low birth weight. Thus, cerebral palsy can be cured, but with regular treatment and healthy diet, it can help improve the child's daily functioning. That's all from us. Thank you for lending me your ears. Have a nice day.